So in today's video, I'm going to go over the top 3 Medicare supplement plans. And if you don't know who I am, my name is Brian Monahan. I've been a licensed insurance agent for 15 years, working with people going on to Medicare for the first time, and also my clients who are already on Medicare to help them with all of their needs as far as Medicare supplement plans, Advantage plans, drug plans, and so forth. So let's jump into the video. If you see on the screen, I have Medicare supplements on the left-hand side, and I have 3 of them. And then down below, I have a Medicare A and B card with some numbers next to them. So the first thing that you have to realize is the first thing that you're going to do when you want to get on Medicare is sign up for your A and B card. Now let me show you this little chart that I have. So this is pretty simplistic, but this is how you're going to complete your package for Medicare. First thing in yellow up top, sign up for Medicare Part A and B. You're either going to do this when you turn 65, or it's going to be done automatically for you if you're already taking Social Security. Or if you're still working and you're getting your benefits, or your spouse is still working getting benefits for you, you might want to deny your Part B when you turn 65 and wait until you're ready to get on Medicare. But let's say for this video, turning 65, you have to sign up for Medicare. You're going to sign up for Medicare Part A and B. You can do this online or go into the Social Security office to do it or call them. The second thing that you're going to do is either choose a Medicare Advantage or a Medicare Supplement plan. As you see on the chart, it's either one or the other. So let me go back to the other screen, because in this video, I'm going to go over, if you choose a Medicare Supplement plan, what those top 3 plans are. So when you get this Medicare Part A and B card, it's going to cost you, on average, the average person, $164.90 a month. That's the first payment that you're going to make. It's going to the federal government. So it doesn't matter if you get a Medicare Advantage plan, a supplement plan, or you don't get either one of these. You're going to pay the government for this Medicare A and B card. Now, there are certain circumstances where you're going to pay more if you're a high income earner, or you could pay less if you're a low income earner. But this is the average of what people are going to pay, is $164.90 each month. Now, moving on to the Medicare supplement plans. The 3 plans that I give to my clients, I only work with 3 plans. Now, I work with 30 some odd companies. It might be Aetna, AARP, Cigna, Transamerica, and so forth. I work with a lot of companies. But when it comes to Medicare supplement plans, I only have my clients choose one of these 3 plans. So it's pretty simplistic. Okay, so let's go with the first plan, Medigap Plan G. Now, if you don't know, Medicare Supplement, Medigap, Gap Plan, these words are interchangeable. They mean the same exact thing. These are the plans that the government makes up the plans, it sends them to the companies, and it says, here, you're allowed to market and sell these plans. So a Plan G is the same, whether you get it through AARP or some smaller company or Aetna or Cigna or anyone. The benefits are the same. The differences will be the price. But what I did is I took an average of throughout the entire United States and put it onto this chart. So you could be paying less depending on where you live, or you could be paying more. So for instance, obviously, if you live in New York, you're going to be paying more. If you live somewhere where it's a lot less expensive to live, it'll be less than this premium. But let's take Medigap Plan G. So you take your $164.90 that you're going to pay to the government, and then on average, you're going to pay a premium of $140 per month for this plan. Now, there's a couple different things that would make the plan cheaper or more expensive. Number 1, it's less expensive for females than it is for males. Number 2, it would be your zip code that you live in. And number 3, it would be if you use tobacco. Now, that's not going to matter if you're turning 65 or you're within your 7-month window, but those are the 3 criteria for what your cost is going to be. So some people ask me, well, if I use it all the time, my card, is it going to go up in price? No, that's not the way that it works. Okay, so the Medigap Plan G. On average, your premium will be $140 a month. And what you will get with this is hospital coverage and inpatient coverage. So your hospital will be zero. This means your surgeries, whatever it may be, will cost you absolutely nothing. There's only one cost when it comes to medical with the Medigap Plan G, and that's this $226 deductible for the year. What this is for doctors, specialists, and so forth. You pay the first $226, and then it is zero after that. So with the Plan G, you can go to the doctor or hospital after you pay that $226 for the year, and it will cost you absolutely nothing. This includes CAT scans. If you look at this chart, CAT scans, also skilled nursing. You will get 100 days of skilled nursing for zero cost. And if you look here, what I did is I put MOOP/YR. That is the maximum out of pocket for the year. If you take your premium, $140, and you add that $226, it's going to cost you $1,906 on average. And then you're complete. So you have your $164.90 a month, then your $140 per month for the premium for Plan G, add the $226, and you'll come up with that number. Now, the $1,906 does not include this $164.90, but that's not what you're purchasing with the Plan G. Like I said, you're going to pay that no matter what. Now, what it does not cover is a drug plan and vision, dental, and hearing. And that's why I have the word no. Some people have asked me in the comments. Now, a drug plan, if you're taking, a lot of people are taking like a blood pressure drug, a generic, or cholesterol, or a few of them. Maybe they take levothyroxine for their thyroid, which is a generic. Most likely you will get a drug plan between $5 and $10 a month. You can pretty much count on that. Unless you're taking brand drugs or you're taking a lot of drugs, it's not going to be that expensive for a separate drug plan. And of course they call that Part D. So Part D is separate from Medicare Plan G. And then, of course, if you want a dental, vision, and hearing plan, you do not have to get one. Yes, you will get a penalty if you do not have drug coverage, but the Part D coverage. But the dental, vision, and hearing is completely optional. If you want to get a plan, of course, you'll have to look into that, see what your dentist takes, and so forth. But that's what it'll cost you, about $40 per month. Now, moving on to the next plan. First thing I want to say is, out of these three plans on the left-hand side, all of my clients going on to a plan now are going on a G, N, or high deductible G, unless they're going with a Medicare Advantage plan. Now, I have videos on Medicare Advantage plans. Those are all over the place. They're completely different. It's really hard to make up charts for those because each individual city has different plans. And even if you're looking at a United Healthcare plan or an Aetna plan, it will be different in different cities. So it's very hard to make it up. These plans are, like I said, the benefits are the same with any state that you're in, except for a few states that do not have these plans, such as Minnesota, Massachusetts, and a few others. All right, so down to the Plan N. Oh, the thing that I was going to say is, before I go through the other two plans, I looked at my client list just this year. Just this year, between these three plans, the G and the N are pretty much 50-50. I have just as many people getting on Plan N as they do on Plan G. A lot of people that watch my videos, when they call me, they ask me, well, what do most people get, or what do you think? And right now, it's about 50-50 people getting on Plan G and N. Let's say it's about 40-40, and then the other 20% get on high deductible G, but it's actually less than 20%. I'd say about 10% of my clients get on a high deductible plan, and the other 90% is split 45% and 45% between Plan G and Plan N. So let me get into it. So Plan N, the premium is going to average about $106. I've seen it at $90. I've seen it at $110. It's going to depend, of course, on your age and so forth. But if you're 65, you can plan around $100 a month. And what is the difference between this plan? Well, there's a few differences. The hospital coverage is exactly the same. As you look at the hospital coverage, it's going to cost you zero going into the hospital. Now, what does cost you with the Plan N is the same $226 deductible as the Plan G. And I hope, stick with me because I'm going to go through this as quickly as possible, so I hope I'm not repeating myself. But Plan N and Plan G both have a $226 deductible, the same one. Now, what's different about Plan N is it will charge, or you might get charged up to $20 each time you go to the doctor. Now, they could charge you $5, $10, whatever they want to charge you, up to $20. The average, they say, is about $13 per visit. Now, what I did was, if you see this plus 10 here, what I did is I put in here that someone got the Plan N and they went to the doctors 10 times that year. And that's how I came up with the number of $1,698. Now, I did that at $20 each time you go for a visit. If you only go to the doctors 5 times and they only charge you $10, you're only going to pay $50 for the entire year for your copay going to the doctor or specialist. But for this video, I put in 10. I put that they charge you the most, and you're still saving $200 a month if you look at this. So if you're someone that does not go to the doctors, you might want to look at Medicare Plan N as opposed to Plan G. There's a few different reasons. Some of them are that if you want Plan G and you don't want any problems, a lot of people, that's what they want. People who are looking at Plan N say to themselves, I think I can save money and I have the same hospital coverage. And even if I go to the doctors, 10 or 15 times, I'll probably spend just as much or the same as the Plan G. Now, the other thing that I have to let people be aware of is there's a 15% excess charge with the Plan N if you go to doctors that do not accept Medicare's payment. It's less than 3% of the doctors in the entire country, and even some doctors that do not accept the payment will let it slide and they will not even charge you that. I can say this, I tell this to people on the phone, I have never personally, and I've been doing this for 15 years, never had someone call me and say, hey, I got to get out of this Plan N. I got charged an excess charge. I hate the fact that they even have this because I think it's ridiculous. It keeps people out of this plan for the fear of it. And like I said, it's less than 3% of the doctors in the country. Sometimes I hear less than 2%, definitely in certain states. Once again, with the Plan N, you will not have a drug plan or dental, vision, and hearing. Same thing as the Plan G. You can get a separate plan. Let's say you get on an AARP Plan G. You can get on a Cigna drug plan, or vice versa. You can get on a Cigna Plan G and get AARP drug plan. So these are interchangeable when it comes to the companies. You pick a company. It's like I always say it's like a buffet. You pick your Plan G with which company you want. Then you pick your drug plan with another company or the same company. And then if you want dental, vision, and hearing, you can pick a separate company with that. Or you can combine them all with the same company. So that's the Plan N. The next one is the Plan High Deductible G. Now, this is kind of, for me, people know right away whether they want this plan. It's very inexpensive for the premium, as you see, on average $40. I've seen it, I think, as low as $28. I think that's the lowest that I've seen. But $28 a month for the plan. But now what do you get with that? Well, you're going to pay 20% of all the costs up until $2,700. So what you'll do is you'll add, You'll add that, and I put the maximum out of pocket over here as $2,700. A lot of people have gotten on my case for that. Basically, you're going to take 40 times 12, which is $480. You're going to add that to $2,700, and that will be your maximum out of pocket for the year if you were to go to the hospital and doctor and reach that deductible. Personally, I have a lot of clients on the high deductible Plan G. The exact number, I'm not sure. Like I said, it's about 10% of my clients. I have not had any of them reach the $2,700 because you would have to go in and out of the hospital and be pretty sick. But not saying that it can't happen, but from what I've heard, my clients say they've gone nowhere near reaching that. Maybe even half of that they've paid, and they've saved a lot of money. But still, some people do not like high deductible plans. So these are the top 3 plans for Medicare supplement plans. Now, if you call my office, I will go over what the costs are in your area specifically and go over the drug plans that are in your area, what they cost. I tell this to all the people that call me. Number 1, you're going to get me on the phone. That's different than a lot of people. Sometimes you'll see videos and you'll call and it'll be somebody else. I have people that answer my phone, but you'll get me on the phone when it comes to an appointment and you want to ask about the different companies and about the different plans in your area. Like I said, a lot of people call me and say, do you work in this specific state? I work in 46 out of 50 of them. And I already mentioned a couple of them, Minnesota, Massachusetts, that I don't work in. Hawaii, I don't work in. So most of the states I work in. So if you call, you're going to talk to me and I'll be licensed in your state and have clients in your state that I can compare with and so forth. But these top 3 plans, I can tell you right now, these plans are fantastic. The Medicare supplement plans have always been great. Some of them, besides these plans, are not that good as far as coverage is concerned. But when you get one of these plans, you're going to have the top coverage in the country. Most people ask me what I would get on or what I would put my parents on and all these different questions. And those are great questions. I would get on one of these 3 plans. It really depends on what my health was or what my income was, how much money I had. If I had a lot of money or if I wasn't worried about it, I would get a Plan G and forget about it because I'd pay the premium each month and then I would say, well, all I have to pay is the $226. If I wanted great coverage, but I wanted to really, I didn't go to the doctor that much, and I'd say, oh, well, I don't go to the doctor that much. Let me start with the Plan N, see where that goes. That's what I would do. And if I really didn't have a lot of money to spend, or I wanted to I was really healthy and I thought, I don't want to spend this money up front. I'd rather spend it if I use it. I would get the high deductible G plan. Thanks so much for watching the video. In the link below, the description box, is links to go to my website where you can sign up for an appointment. And also you can get my book down there, Medicare Without Confusion, where I'll show you real quick. This is where this chart came from. The book, you don't purchase it. It's free. It's directly on my website. It has videos on there, and you go directly to the link, and it'll take you right to the website, and you can this is what you'll see. You can start reading it. So thanks so much for watching the video. I hope this helped, and I'll see you at the next one.